Okay, now we'll talk about the first case.
Mm-hmm.
Female present with a frequency, urgency, dysuria. So what's your differential diagnosis here?
Frequency, urgency, dysuria, a UTI.
Yeah, so it could be pyelonephritis,
Mm-hmm.
it could be PID, it could
Yeah.
be urethritis, it
Mm-hmm.
could be cervicitis,
Mm-hmm. Right.
it could be vaginitis.
Cystitis.
Okay, so the for a pelvic inflammatory disease, we need to order beta HCG,
Right.
and you counsel if it's positive, counsel, and you give a prenatal vitamin.
Mm-hmm.
Okay, for urethritis, you need to do urine culture and repeat in 1 to 2 weeks. That's very important. Okay, if there is
Okay.
high risk of being cervicitis or vaginitis, mean STD infections, okay,
Mm-hmm.
you can do STD panel.
Mm-hmm.
If there is higher, like multiple sexual partners and high risk of sexual transmitted illnesses, then you do gonococcal culture, chlamydia, and you can do the HIV, hepatitis, C virus and B virus, and syphilis also, RPR. You can test for those.
Mm-hmm.
Okay, if there's a vaginal discharge, you can do wet mount.
Okay.
Okay, and KOH. Now the management, if this is just a cystitis, now there's the management. If it's uncomplicated, how do we treat that?
If it's uncomplicated cystitis, trimethoprim sulfa. Yes, 3 days.
Yeah, 3 days of TMP SMX.
Mm-hmm.
Okay, if allergic, then you give him Cipro. Okay, if it is complicated, when do we call it complicated? If there's an indwelling catheter, if there's a diabetes, okay, like this,
Mm-hmm.
if there's diabetes, if there is catheter, if there is recurrent, if the age more than 65, that's complicated, okay, and so on. If there's a comorbidities and stuff, then in this case, we treat it with 7 days of TMP SMX. Okay, what if cystitis with a pregnancy? How do you treat that?
Cystitis for pregnancy, then we can give them um, one of the cephalosporins or nitrofurantoin. But I have a confusion about nitrofurantoin. We're not supposed to give it in the first trimester.
Yeah, just the first trimester. Yeah, so you can, but the second and third you can give it. So you give it 7 days of nitrofurantoin. If allergic, what do you do?
Then one of the cephalosporins.
You can do 7 days of amoxicillin.
Okay.
Okay, and you never TMP SMX never, because it can cause folic acid antagonists, folic acid antagonist.
Can
So
you give one of the cephalosporins?
Cipro never, because due to cartilage damage.
No, not cipro. Cephalosporins.
Yeah, you can give that.
Which one?
But cephalosporin, we leave it for pyelonephritis, which is more complicated form.
Okay, not for this.
Yeah, not
Okay.
for the cystitis. Okay. So basically, that's the main thing. Now, for this case, we want to talk about the location. It's an
Okay.
outpatient management. You don't need to admit the patient, and
Because
then the timing. There is some important stuff about timing and
mm-hmm.
monitoring. The monitoring, you want to do urine culture in two
Mm-hmm.
weeks. That's a monitoring, and timing. You want to do pregnancy test beta HCG before antibiotics. Okay, those are the important
Mm-hmm.
stuff here. Okay, so now this is for cystitis.